I'm Ryan Alley, and I'm here with Dr. Wilcox as part of the point of care ultrasound in primary care course. We're going to be demonstrating for you an application of renal ultrasound today. Now, lithium-induced renal disease is not necessarily the most common illness or adverse effect when it comes to the treatment of manic episodes in bipolar 1 disorder, but it is an important clinical entity to be able to recognize. And renal ultrasound has many indications that we'll go ahead and discuss now. When a patient comes and presents to you with signs of renal disease, including increased creatinine, increased BUN, or decreased EGFR, it might be worthwhile to perform a point of care examination of their kidneys using ultrasound. Additionally, if a patient comes to you with signs or symptoms of diabetes insipidus, including excessive thirst, excessive urination, or excessive fluid intake, might be another reason for you to perform point of care ultrasound, especially important when that patient has been on lithium therapy for a while. Now, I'm going to go ahead and show you how we go ahead and do that point of care renal ultrasound, but I'll discuss some contraindications now. There are no definite contraindications when it comes to performing renal ultrasound. You might want to be careful if a patient has overlying signs of infection or breakage in the skin. But really, the biggest thing to be concerned with is if you're ever unsure about your findings, if findings don't look perfectly normal, then you might want to consider a formal ultrasound study to be able to determine the cause of any potential pathology that you might be seeing. I'm going to go ahead and put the abdominal preset on our device here. I will put some of our ultrasound gel on the probe here. And when using an ultrasound device and examining the kidneys, you want to use a curvilinear probe. Now, I will ask our patient to go ahead and expose their side, and I will be looking for the costovertebral angle here. I'll feel for it, and I'll go ahead and put my probe in that region. Now, you want to go quite a bit low because the kidney is in the retroperitoneum located posteriorly at that costovertebral angle, and you'll want to find your kidney. If you're finding it difficult to visualize the kidney, then you can go ahead and ask your patient to take a breath or roll over to their side to be able to visualize your kidney a bit easier. Now, once you have found the right kidney, the left kidney might be a little more difficult to be able to locate due to the overlying rib in the area. Now, there are some possible pitfalls when it comes to renal point of care ultrasound. Like I said, the left kidney might be a bit more difficult to visualize when it comes to your point of care examination. You may want to attempt to use the phased array probe to visualize between the ribs if it comes to that, but with good use of fanning, you should be able to identify your left kidney. Now, when assessing for lithium-induced renal disease, there might be comorbid chronic kidney disease or polycystic kidney disease that may confound your diagnosis. As always, consider formal imaging when you're unsure about any pathology that you identify. Now, possible pathology that you might be able to identify on point of care ultrasound for a patient experiencing lithium-induced renal disease include such confounders as a simple renal cyst, polycystic kidney disease, or renal cell carcinoma. The visualization of lithium-induced renal disease is pretty unique and pretty characteristic. It includes numerous uniform microcysts and punctate echogenic foci, which may be cortical or medullary in origin. The kidneys are normal in size. As you can see, it might be easy to mistake this for several cysts or maybe even a more malignant cause of pathology. Now I'll want to go over a case of a patient that you might see coming in with some kind of kidney abnormality who is on lithium. Let's say you have a 30-year-old patient with a diagnosis of bipolar 1 disorder on lithium therapy for over a year to manage manic episodes. This person presents with increased thirst, increased fluid intake, and excessive urination. They're determined to have a low urine osmolality. You perform renal POCUS and identify many small cysts and small punched out, small echogenic spots. While waiting for formal imaging to confirm findings, a water restriction test is performed, and the patient is determined to be experiencing nephrogenic diabetes insipidus. You discontinue lithium and begin valproate for mood stabilization. If discontinuation of lithium is contraindicated due to safety concerns related to manic episodes, then amiloride can be added to minimize lithium accumulation in collecting tubule cells. And that completes our presentation on renal point-of-care ultrasound and the application of lithium-induced renal disease. Thank you.